Welcome to Medicare 101, sponsored by Medicareful.com. In this brief session, we'll cover the following topics: Medicare eligibility, the A, B, C's, and D of Medicare, all of the options available to you to supplement your Medicare benefits, and how to get more help. Before we get started, here's a little information about Medicareful.com. We are not affiliated with Medicare, the Department of Health and Human Services, or any governmental agency. We're not affiliated with any insurance company. We're a website to provide you with information about your Medicare options, and we're supported by local agents in your community. Now, Medicare is a health insurance program for people who meet one of three conditions. They're 65 or older. They can be under 65 with certain disabilities, such as end-stage renal, or they are under 65 with certain disabilities. If you are 65 or older, you qualify for Medicare Part A premium-free if you or your spouse worked 40 quarters or 10 years of Medicare-covered employment. Even if you have less than 40 quarters, you can purchase Part A for a monthly premium. Let's talk about what Medicare Part A covers: hospital inpatient care, skilled nursing facility care, home health care, hospice care, and blood. Now let's talk about Part B. Part B is a voluntary benefit, but enrollment is automatic. So if you don't want to pay a Part B premium, you must opt out. There are 3 enrollment periods. The initial enrollment runs for 7 months, starting 3 months prior to your month of eligibility. If you opt out of Part B because you have employer-sponsored group coverage based on your or your spouse's active employment, you'll get a special enrollment, which runs for 8 months after your coverage ends. If you opt out of Part B and you don't have qualifying employer-sponsored group coverage, you can get Part B during the general enrollment. The general enrollment is January 1st through March 31st, and your Part B coverage will begin on July 1st of that year. If you enroll in Part B during general enrollment, generally you will have to pay a 10% penalty for each 12-month period you are eligible and not enrolled. Let's talk about what Part B covers: doctor services, outpatient surgical services and supplies, diagnostic tests, outpatient therapy, outpatient mental health, preventative health, and other medical services. The premium for Part B in 2010 is $96.40 a month for those who enrolled prior to January of 2010, and $110.50 for those who enrolled January of 2010 or later. If you have higher incomes, you may pay more. Part C of Medicare is also known as Medicare Advantage. Medicare Advantage plans are offered by private insurance companies, and you get all of your Part A and Part B services through the plan. There are many types of Medicare Advantage plans, such as health maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, Medicare medical savings accounts, and other plans which include cost plans, demonstration plans, and programs for all-inclusive care for the elderly. So let's talk about some of the key features of Medicare Advantage. Likely, you'll have to use the providers in the plan's network. The benefits and costs are approved each calendar year and may differ from original Medicare. You'll likely still pay your Part B premium, although some plans may pay all or part of your Part B premium. You could get extra benefits like vision, hearing, or dental. You could get prescription drug coverage, and regardless, you're still in the Medicare program, so you still get all of your Part A and Part B services, and you still retain your rights and protections through Medicare. So let's talk about Part D, the Medicare prescription drug benefit. Part D is available to all people with Medicare. and it's provided either through a standalone prescription drug plan, a Medicare Advantage plan, or some employers or unions. The premium for Part D will vary depending on the plan you choose. In addition to any premium, you might pay a deductible of up to $295, co-payments or coinsurance associated with the initial coverage, all costs in the coverage gap, and very small co-pays or coinsurance after you reach $4,350 out of pocket. If you qualify for Medicaid, or if you have limited income and resources, Medicare offers extra help with your drug costs. If you receive a full subsidy, you will pay no premium, no deductible, and have small or no co-payments. If you receive a partial subsidy, you will pay no or reduced premiums, have a reduced deductible, and pay a little more out of pocket. If you have Medicaid, you receive supplemental security income, or you qualify for help paying your Medicare premiums, the Medicare Savings Program, you automatically qualify. Otherwise, you must apply. You can apply with Social Security, you can apply with your local Medicaid office, or you can apply online at www.ssa.gov. Now let's cover your options to supplement your Medicare benefits. Medicareful.com provides you with a complete listing of every option available to you in your zip code. Simply enter your zip code and click on Submit. If your zip code covers 2 or more counties, you'll be asked to select your county. Simply select your county and click Submit. Here you get a display listing the 14 ways you can get your Medicare benefits. If you click on See Available Plans, if this type of plan is available in your county, you'll get a complete listing. We display the carrier name, the plan name, the phone number, and a link to their website. Additionally, you can get in-depth details about each option by clicking on Learn More. You get information about whether this is the right option for you, the advantages of this option, disadvantages, and cost-sharing information. Finally, we display a local licensed independent insurance agent who is in our network and close to your zip code. Keep in mind that all of this information is available to you without us requiring any personal data from you. We respect your privacy and choice, so you can use this website to learn about your choices, you can contact the insurance companies directly, you can call 1-800-MEDICARE, or you can use the licensed agent in our network. If you'd like the agent to contact you, you can click on the Get Help button and leave your contact information. That choice is entirely up to you. We only share your personal information with one agent, the agent you see on the screen. We never share your information with anyone else. We do business this way because we believe you have the right to know up front exactly who it is who will be contacting you. Thank you for your time. I hope you enjoyed our brief video.